So many of you know about the fight against breast cancer. In fact, many of you have probably even donated to organizations that help with that fight. Today we're going to talk specifically about research behind breast cancer and how important it is. And I have two excellent guests joining me today to talk more extensively about that. We want to welcome Ms. Patty Harman, who is the Executive Director of the Susan G. Komen Greater Nashville Area Chapter. And then we also want to welcome Dr. Deborah Lannigan, who's an Associate Professor over at Vanderbilt University and deals specifically with the research. So welcome, ladies.
Pleasure.
We're so glad to have you here. I know that Susan G. Komen's involvement in the fight against breast cancer and also supporting these breast cancer patients is just crucial, and it's amazing what you all have done over the years. Tell us, though, how research figures into the overall mission.
So for us, our goal is to eliminate breast cancer. And in order to eliminate breast cancer, we have to have research. Research is vital in making or allowing us to get to the point where breast cancer does not exist.
That's great. When we're talking specifically about statistics, a lot of folks don't necessarily know how many people have breast cancer. And I don't know if one of you ladies can talk statistics for us, please.
Certainly. So breast cancer is the second cause of cancer among women. And overall, a woman has a 1 in 8 chance of being diagnosed with breast cancer over her lifetime. So we're making great strides in treatment, and that's evidenced by the fact that there's 2.8 million breast cancer survivors in the U.S., but we still have a lot of work to do because 40,000 women die each year from breast cancer.
Do we know, Dr. Lannigan, what causes breast cancer?
That's a great question. We know a small percentage of breast cancers are caused by genetically inherited diseases. But overall, we really don't know what the causes are. But we can work on providing ourselves with the best health possible by eating right, exercising, going into our physician, and having a good social network.
Okay, we want to talk, like I said, specifically about research. Why research? I mean, what are we trying to learn with this research?
So basically, research provides cures. So the goal of current breast cancer researchers is to really find those new cures with our ultimate goal of really preventing breast cancer.
All right, I understand that Komen-funded breast cancer research is being done right here in Middle Tennessee at Vanderbilt University, and that's what you do. Kind of explain that, how it kind of all works together, if you don't mind.
Absolutely. So it's my pleasure to have a Komen grant in collaboration with Ian McCara. And so our grant is about, first of all, we're developing a novel drug that was isolated from a plant found only in the South American rainforest, and that we think will be useful for the treatment of breast cancer metastasis. And the second part of our work is that we're really trying to develop a better way to test drugs before they go into the clinical stage of testing. And we use as a model system is living human breast cancer tissue. So not only is that going to be a new way for testing drugs, but we want to be able to evolve it into a personalized medicine approach for women being treated.
All right. What is it in particular that we're trying to learn, though, specifically with your Vanderbilt research?
Well, I want to move this drug into the clinic, and I want to be able to identify what are the basic causes. There's different types of breast cancer. They all have different underlying causes. So I focus mainly on triple-negative breast cancer, which tragically strikes young women and has a very poor prognosis. And there's currently no really good targeted therapies available for it. So that's my primary interest, and that's what my Komen grant's about.
I think people are fascinated in the research aspect. If you don't mind answering this question too, specifically in your lab, because for folks who might not be able to ever go visit one of those labs, talk a little bit about how many people you work with and who's trying to actually strive to make this goal happen.
So I have 6 people in my lab, and we all focus on breast cancer research.
Okay.
But I also have a collaborator. I have breast cancer surgeons and pathologists that I work with because we have a constant need for living tissue. And so it's a whole team, and Ian McCara's team has about 12 people on it, and all his people work on breast cancer research. So we're just one group whose quest is to really identify what are the causes of breast cancer in triple-negative breast cancer.
Are you meeting on a weekly basis? How does the operation work?
Well,
then?
Yes, we have close connections with my collaborator and phone calls and emails, and of course I meet with my people every day. I mean, that's what's the great thing about science is there's always new discoveries, and thinking about them, and you go home thinking about them, because we're really very passionate about, we want to find a cure, we want to help people, and I think all breast cancer researchers, all researchers are like that.
Yeah, behind the scenes though, I mean, you just can't be trying to explain to folks, I imagine it's pretty exciting to let people know exactly what you're doing back there, you know, because like I said, no one really has the opportunity to go back into a lab. So being able to hear from someone who actually does the research is just so important, so amazing. I imagine it's changed a lot over the years too. Compared what you all do in this day and age to 15, 20 years ago, obviously a vast difference.
Well, certainly the technologies that have been developed are just amazing. So now we can get answers to very complicated questions. And I think one of the most really amazing things about breast cancer research is that the knowledge that every breast cancer is unique to that individual. And that's really revolutionizing how we think about breast cancer, and it's going to impact on how we treat breast cancer.
Sure. I'd like to talk about how the research is funded here in just a moment. I'll kind of ask, you know, both of you to maybe talk a little bit about that. But Patty, I'd like you to discuss, if you don't mind, how you all work with Vanderbilt and how your, you know, relationship has been, like with Dr. Lannigan, and how often you all are kind of mixed in conversation.
So as a local affiliate, we are really fortunate to have Vanderbilt here in our back pocket. Since '92, about $9 million have come from Komen into labs at Vanderbilt, and so it provides the opportunity for us to really learn more about the research component. And as I said, research is vital to finding the cure, and as a person who's not involved in research every day, it's kind of hard to comprehend. It's kind of hard to understand the whole component, and so having people like Dr. Lannigan here able to explain that, able to explain to other people what they do really makes a difference.
Absolutely. And I would like you to explain, Dr. Lannigan, how this research is funded, because that's something else that people might not be familiar with.
Well, the primary source of funding is by the American taxpayer, and that money from your taxes goes to support the National Institutes of Health. And then the second big provider is by private foundations like Komen. And I would like to point out that government funding has been decreasing for all research over the last decade and has reached one of the lowest levels that it ever has been. And so basically, without money, you don't have research, you will not find cures. So private foundations like Komen are just crucial for us at this juncture.
It's almost as though you rely on those private organizations
Absolutely.
like Susan G. Komen, because that's just the other pipeline of funding for you all, especially when you're talking about the government money not necessarily being allocated the way it used to be. And obviously there's a lot more to research out there nowadays too, so they probably have to spend their money in different ways, I imagine. As an individual, somebody who's sitting at home and they're watching today and they're wanting to know, you know, how can I actually help out? Because I'm one person. I can write a check maybe, or I can maybe go and do the walk or something like that for Susan G. Komen. But what can I do to be able to help in research? What would either one of you say to that?
Well, one of the big things that you could do for research is to contact your government officials, your local and federal elected officials, and tell them that you think that breast cancer research is important, that research is important. They'll listen to you. And really, it's grassroots efforts that really make a difference to the National Institutes of Health, the NIH budget. So I can't tell you how important everybody is to really making it go. And I think getting involved in affiliates like Komen is a way of showing your support for the researchers. While we're working in the lab alone, it's really nice to know that there's a team out there who really, you know, wants us to succeed and is engaged with us. It can be really hard and alone a lot of the times, and you know, to have the comfort of knowing that you have people that care what you're doing in the community is really nice.
Well said. What would you like to add, Patty?
I would just like to add that I think women need to take responsibilities for their bodies, and I know that's not really research-minded, but it is part of the whole eliminating breast cancer. And so, really knowing your body. If you have a problem, that you go to your doctor. I think that's really important. I also think when there's studies available that women can participate in, that they do take the opportunity to participate in them, that they contact their local officials, that they just act. You need to be progressive. 1 in 8 women still get breast cancer, and even though we've come a really long way, we don't have a cure. And it's going to take all of us working together to find that cure.
Sure. And there's a lot of information out there, obviously, for folks to be able to go and get online and just make it happen. But I think what you all both have said today is, you know, again, really important information that some folks might not know. So we so appreciate your time. Again, Dr. Deborah Lannigan, Associate Professor over at Vanderbilt University, and also Patty Harman with the Executive Director of Susan G. Komen here in the Nashville area. Thank you, ladies, so much for visiting with us today.
Thank you.